Hello and welcome to today's webinar on mastering the annual program evaluation process through myvaluations.com. Jay is also available as an organizer to answer any of your questions. Feel free to submit any questions, and at the end of this webinar we'll have a Q&A as well. Today's webinar is going to be approximately an hour and a half long. We are going to focus on 5 main topics. First of all is understanding our new APE framework, which will be reviewed towards the end of the webinar. At the beginning, we're going to do an in-depth look at the APE process in general, and then we'll look at the new APE functions and what are some of the new strategies that we're adding in and the new design and functionality. We're going to discuss the data that you have and how to utilize that data effectively for your program analysis, as well as discussing best practices for tracking your goals in terms of your action plans. We will have a focus on maintaining compliance as far as ACGME site visits are concerned and your self-studies, and how to engage your stakeholders in the APE process in terms of creating strategies that involve your faculty, residents, and other key stakeholders, just simply based on their involvement and their ability to give direct input into the APE process. As part of today's discussions, you might see some abbreviations throughout the system. I want to make sure that you're familiar with these abbreviations. MyP is a reference to my portfolio and my evaluations. APE refers to the annual program evaluation. PEC is the program evaluation committee. QI, quality improvement. There are 2 types of action plans in the system. One is based on the PDSA model, which is Plan, Do, Study, Act, which generally is more of a quality improvement project study. And then there's the SWOT model, which is based on strengths, weaknesses, opportunities, and threats. I will review both of those models with you today in terms of how to utilize them. And you'll also learn that when you're doing action plans, it's not mutually exclusive. You could do both of those at the same time, where you're doing a short-term SWOT analysis and a long-term PDSA study. So getting right into the APE module, it's important to understand that an annual program evaluation is focused on core faculty and core trainees. In other words, you might have a very large subset of trainees in your program that are not your core trainees. They could be rotators, they could be residents from other departments that are interacting with you. They could be rotators from external institutions that are coming to you. Those trainees are not included as part of your APE process. And as far as your faculty is concerned, not all your faculty is included in the APE process either. It's only your core faculty. And a good way to look at that is to think about your process of updating your ACGME core trainee and core faculty list. When you're identifying your subset of residents and fellows in the ACGME ADS system, the APE model in my evaluations considers exactly that same list. And because of that, the system does not automatically display all the residents and all the faculty in the APE module. So it's very important that you go through a process of actually identifying those core personnel. Before you get processed, you start in the entire process. If you don't do that, you're going to have a problem of having a lot of extraneous data load up into the system. So it's really important that you follow that one key process before you go in. So looking at our logging into the system, you're going to learn today that you're going to access the APE module from the menu option evaluations, and you have the APE module right here. directly below it is the managed core personnel. So before you get started with the APE process, you really need to go through and define that. Who's our core faculty, who are our core residents, and who are, if you have any fellows, who are the core fellows. You can see there are options for you to have core students, nurses, and technicians as well. And these settings are specific to the academic year on the top right-hand side. Addressing this is really quite straightforward. We click on edit if we need to edit an existing list. For each academic year, you're going to have your core attendings, your core residents, and or core fellows, and you want to make sure you add those individuals. It's important that you appreciate that only those individuals that are listed in the core attending and core trainee list, only their data will show up in the APE module. So I'm reiterating the importance of that idea. When we look at future academic years, in order for the system to help you start with a default list, the system will take a look at your previous list and update it. So when I look at 24-25, I'll have a list there, and if I go to the next year there, where I don't have a list, I can click on Modify Core Personnel, and it'll provide me with the option to select a different academic year, and then update a new list for attendings and trainees in that particular academic year. So here you access that from Manage Core Personnel. And again, I'm reiterating that that list should match the list of names that you have with ACGME ADS. So when accessing the APE module, typically you want to allow about 20 seconds for that module to load. And really the amount of time it takes to load that information is about roughly 20 seconds, but the more data you have, it might take a little bit longer. Periodically, you want to save your work by clicking Save and Finish Later. This module loads all your data up at once for you so that you can navigate throughout the whole module and make updates into it without having to load each section individually. The option for clicking Finished Final Submission really doesn't occur until the very, very, very end of the process. So once I've set up my core personnel, I'm going to click on Annual Program Evaluations. So again, this process here, by clicking on Annual Program Evaluations, typically should take you about 20 seconds. And during this process, for the default academic year, which is the current academic year, the system is actually loading all the associated data for the department. And there you have it. Now, there is a walk me process that carries you through this module. You can see that walk me process has already skipped steps 1 through 5, and it's defaulted to step 6 of 10 over here, and it's guiding you on the process of what to do. You can X out of that by clicking on the X. I'm simply bringing up this page just to show you the basic module that we're going to talk about today. If you need to reinitiate the module for walking you through, you can walk me through the committee section, initiate that. It will take you through each step one by one and guide you on what to do. There's also a teach me how to use the AP module that you could click on that will initiate a walk me through the whole module to guide you through the entire process. What we're going to talk about today will be a lot of that, but we'll also talk about the actual integration and the data integration process. So when looking at this process, you'll notice that you have 2 buttons here. You have a Save and Finish Later button, and you have a Finished Final Submission button. If you click the Finish button before all the issues have been addressed, it's simply going to tell you you can't finish it because there are certain items that still need to be completed. You can see in here I'm close to being finished. but I still have items in the monitoring section that I need to review and take action on. We're going to discuss that during our webinar today. So in the APE module, the entirety of the process is the integration of all your data, where all your information is being centrally presented under the various tabs that we're going to review today. So in order for you to have a meaningful process for your program evaluation review process, you'll notice that throughout the module, you're going to have these take action plans. And in the take action plans, as I mentioned, there are two models. There's the PDSA and there's the SWOT model. And in the PDSA model, you're going to actually create a plan. Then you're going to actually take action on it in terms of what are the specific steps you're going to take to execute the plan. And then you're going to study or measure the results or the observations from the outcomes of the actions that you took. So I plan on doing something. This is what I did or I am doing. This is the result of what I did. And then what actions will I take as a result of what I observed? And this type of action plan is typically more of a study where we plan on something, then we will take action on something, then we will measure the outcome, and then we'll monitor the consequence. It is a bit different than when we look at a SWOT model. A SWOT model, you're going to identify either a strength or weakness in the first step, and then identify whether there is an opportunity for you, yes or no. Is there a threat to your organization, yes or no? And then what do we need to do as an action plan? And this type of format is a little bit different because we're immediately identifying a weakness or a strength. For example, maybe the results of the in-training exam came in and we identified that 70% of our trainees are doing poorly on a particular category of the in-training exam. So we identify that as a weakness, and we might say, for example, weakness is, just making this up, poor performance on nephrology section of the ITE. Is there an opportunity? Yes, the opportunity is to introduce more hands-on learning dealing with nephrology, including courses and classes that focus on that topic in terms of lectures and conferences. Is there a threat? Yes, there's a threat because there's a risk that our trainees may not pass the board exam because of poor performance in the nephrology section. And what's our action plan? We are going to have at least 2 nephrology topics taught at our noon conference every month. And who am I going to assign this to? When is this due by? And what's our current internal status? And who will receive notifications? I'll review this in more detail with you. This is just a very quick overview because I want to set the foundation of what the entire APE module is about. So there's this idea that we have a ton of data that we're already collecting in my evaluations. We're collecting this data from all the evaluations we do, all the procedures, the patient logs, the clinical hour tracking. We're scheduling, we're sending out curriculum notifications. The ACGME has sent us citations or areas for improvement. All this information that you have put into my evaluations or has been collected in my evaluations is then systematically presented to you through the APE module. And whenever you identify a particular area of weakness or a particular issue in the system, then you can say, aha, we're going to initiate a take action plan, and we can do a PDSA and or a SWOT. So both of them are possible to be done simultaneously. You're not obligated just to do one or the other. So again, this is just to give you the basic foundation of how the entire APE process is going to work for you. So our goal here at MyValuations is to make sure that you're utilizing as many parts of the system in order to streamline your APE process. And simply by streamlining that APE process, it becomes much easier for you to manage your entire APE process. As a quick example, what I mean by that is if you're using the myvaluations.com clinical hours module for tracking your clinical hours and you're using it for tracking your conference attendance, then when we go under the program section and we look at the clinical hours compliance, the system will automatically populate all your clinical hour compliance data by rotations. As far as conferences are concerned, all those conferences where not about the attendance alone, but specifically about faculty and residents who are the presenters at those conferences, all that information is then tracked under personal presentations of scholarly activities. So the system will automatically report for you the percentage of your trainees that are doing personal presentations related to scholarly activities, and the system will also track that information for your faculty in terms of scholarly activities that they're performing. And all of that can be generated into an ACGME related report that the system can generate. So the connection here is we're always striving to get you to use more of the modules to help you better utilize the APE module for doing your self-studies, for doing your annual reviews, and to do your institutional reviews. So looking at the entire workflow process of the APE module, it's user submission of data, they complete evaluations, they review their curriculum. Then there is also ACGME data importing. You're going to learn that you can import case logs. So programs such as obstetrics and gynecology, general surgery, all these programs where the residents are required to report their case logs into the ACGME ADS system, you'll learn that you can export that data out of ADS and import it directly into MyValuations. So you can have that data that your residents are already reporting in the ACGME website be present in MyValuations, so it can be included as part of your APE process. And then the third component of data that's coming into this funnel is the automatic data. The automatic data example would be the conference attendance as an example, or your evaluation and milestone performance, or your clinical hour performance. All of that is your automatic data. And then all this then feeds into the APE module, which then allows the program evaluation committee to review that information and provides you with performance documentation and plans that you can present as well. So this then connects to your ability to monitor all the action plans with automatic email notifications, allowing you to have overview of what's going on. So this is the entirety of the idea of what you're going to do with the APE process. Collecting data up the top, it all feeds into the APE. You set up your program evaluation committee, so specific individuals are involved in the process. You review the performance and document plans, and then you monitor those action plans year over year to make sure that you are compliant with those. So this will be part of what we'll review today in the APE module, where we can go to the monitoring tab and we can see year over year how many action plans do we have. We had 4 action plans in 2019, 1 in 2021. We haven't had any action plans since, for example. And then we can see all those implemented action plans here at the bottom. And then we can see the incomplete action plans here. Specifically, these are going to be the action plans that we're working on right now. What are our action plans and what citations do we have to review as well? Well, we're of course going to review all of this in detail as we go through all of our modules. So in terms of the ACGME data importing, you have a couple of ways of importing that data. From the menu option evaluations, under program management and reports, you have access to importing scholarly activities, well-being survey data, and case logs, as well as importing the survey results. So all of this information can be imported directly into the APE module. So when you go to the menu option evaluations, under the program management and reports, you have WebAds scholarly activity, well-being, and case log importing. That the third component for the surveys, those are imported directly into the APE module, and we're going to review that today. Under the program tab, you're able to import your ACGME survey results in here, both for your residents and for your faculty as well. So all of that data from your surveys for faculty and residents, as well as your well-being surveys, all of that is tracked in the system over a 5-year trend, and all your case log data is also tracked in the system under the procedures and patient log module. So in terms of any data that you've imported from your case logs will be here as well. Again, we're going to review all of this in great detail. All of this is to lay a basic foundation for you. And then, of course, I showed you that you can go to the evaluations module and do the same thing there as well. So I want to do a quick overview with you in regards to the ADS scholarly activity importing process. I'll share with you one quick thought, and that has to do with your data exporting out of ADS. If you're unfamiliar with how to do data exporting in ADS, we have tried our best to keep up with the changes with the ACGME. And the reason I say do our best is because the ACGME will make changes and not necessarily communicate those to the vendors. But when you go into the APE module under the program tab for ACGME residents and faculty surveys, there is a instructional document for exporting survey results out of ADS that will actually provide you with instructions on the process of logging into ADS and how you go about pulling that data. These views do change somewhat rapidly on the ACGME side, so that the views may have changed on the ADS side. My evaluations does not have direct access into those views. So if you find that the actual data exporting process has changed on the ADS side, certainly communicate that to us, and we'll do our best to update those instructional documents with the new screens and new images. So suffice it to say that you are able to export reports and data out of ADS. ADS does not offer a direct data connectivity. In other words, there is no possibility for us to directly pull that data from ADS. You have to log in, export the data, and then import it into my evaluations. So for the 3 data points that I shared with you here, in terms of scholarly activities, well-being, case logs, and also for the surveys, you're able to directly export data and PDF reports out of ADS and import that information directly into my evaluations. We're going to look at 2 examples of how you do that data importing, just so that you're more familiar with the process. So as an example, if we're looking at scholarly activity data importing, we'll go to the menu option evaluations, program management reports, and click on the ADS scholarly activity importing. It's a 3-step process. So in step 1, you're going to decide, am I importing data for residents or for faculty, and for which academic year, and then I click next. So that's all this information here. And we're going to look at that in real time as well. The system in step 2 will automatically match the data between the imported fields that are coming from ACGME and the fields in my evaluation. So in this third column here, you're actually seeing the matched data that that shows you everything that is getting pulled into the system. You'll click next here, and it'll take you to step 3 of 3, which is going to show you the data that you're importing, and it's going to ask you to click confirm data importing at the bottom. And once you click confirm data importing, it'll simply give you a confirmation page showing you all the data that has been imported into the system. What's beautiful about these data importing processes is you can do them as frequently as you want in the year. Each record has a unique identifier, so you're not going to get duplicate records. So if you want to import your scholarly activities or your case logs multiple times during the year, you can do that. It's really simple, really super straightforward. So let's look at that as an example here. Let's say we're importing data for faculty. We want to import it for the current year. We click on Browse, and we select our faculty scholarly activities that we've already exported. Click Next. And as I mentioned in step 2, it's automatically matching the fields. So if I unmatch this, it's just to let you know that the system is identifying the academic year filter and automatically matching that. So then we just click Next. It takes us to step 3. It's now actually pulling all the data. I can click on View to look at each individual data point that I'm importing. I click Confirm Data Importing, and it'll import that data and give me a confirmation of all the data that was imported into the system. So really straightforward, simple process for you to be able to export all that data out of ADS and then import it directly into the system. The same process is going to apply for importing your case log data, and a similar process is going to exist elsewhere. Now, notice in this case, because I'm importing a data set that doesn't have some users, it tells me that user not listed. So if, for example, I'm importing data for this particular individual and they don't exist in my system, then the system won't be able to pull in that data. So this is your confirmation. Obviously, I'm using an example over here to illustrate using actual data, just to give you a clear understanding of how that works. Now, moving on from that, another example is for case log importing. Similar process, except with case log importing, you don't have to actually select an academic year, and case logs are only coming in for trainees, so you don't have to select the user type. So you only select, you click on Browse to find the file, and then you click Next, and that's going to then take you to step 2, which will again automatically match those fields for you. So all you need to do is to click Next in step 2. It'll show you a data set for the data that you're importing into the system. And in step 4, when you click Confirm Data Importing, it'll give you a confirmation page with all the data that has been imported into the system. It'll identify that data for you as imported successfully. So this is these 4 data set items for surveys of residents and faculty, case logs for those of you that have case log reporting in ADS, any scholarly activities from previous years that were reported in ADS and not necessarily tracked in my evaluations, and your well-being surveys. These 4 data points are things that you can easily integrate into my evaluations to allow you that longitudinal graphical review of performance that is so important in our review. This idea of having a graphical layout of all of our surveys year over year and being able to see how we're doing and to be able to set action plans for specific areas of weakness. So now that we understand the HGGME importing component, the second, remember there were 3 data points that are feeding into the APE funnel. The second data point has to do with user submission of information. So those are going to come, for example, from evaluations, your faculty and residents completing evaluations. So there's three main categories of evaluations we're looking at. We're looking at the evaluations that are being done on trainees. How are those doing? We're going to look at evaluations that are being done on the faculty. How are those doing? And then third component are the evaluations that are being done on the program itself, or the rotations. So those are the three sets of evaluation data points that we always want to look at. And that simply means by those evaluations being completed by your residents and by your faculty, that data will automatically feed into the APE module without you having to take any extra action. So, and what I mean by that is you'll see later on when you go to the program tab and you look at program evaluation performance, all of those evaluations, for example, on resident summative evaluation results are listed. So each individual evaluation that you're using in your department, each one is listed individually, and I can say, oh, I can see how the PGY1s are doing compared to the PGY2s, compared to the PGY3s. So if I'm on the program evaluation committee, I don't have to generate a report to see how are the residents doing on the various evaluations. I can see that directly here. And if I go in, I can even click on a specific data set and it will bring the associated results in for me. And in the table below, all we're doing is we're displaying the raw data for you. So you have a graphical layout here, and then here you have the actual data. And as I scroll down, and yes, there are, in this sample department, there are a lot of different evaluations. Then I'll come to the section here for faculty summative evaluations. So here I can see there are two types of evaluations that are being done. One is called a QA123, another resident evaluation of faculty. And I can see that there are two types of faculty that are being evaluated. And there's a key here that tells me that Surge 00 is general surgery, and the NSHN is anesthesiology for head and neck. So this is telling me in one single report, how are the faculty being rated? And then the third section here are program summative evaluations. So how are the surveys in terms of residents reviewing the rotation and reviewing the program? And in this case, the data that we have in the sample department is not rotation specific. So it says no rotation. And if there were multiple rotations, they will all be listed here. So that whole idea of user submission of evaluation data feeding directly into the APE module is illustrated there. Then we look at things such as conference attendance. And I illustrated that for you earlier when we were looking at the evaluations, the conference attendance and the scholarly activities. So every conference that you schedule where a resident or a faculty is a presenter, that information automatically feeds into the scholarly activity report. In addition, that information also feeds directly into your scholarly activities reporting that you can do for ADS. As a quick reminder to you, if you go under the menu option, My Portfolio, as an administrator, you select the option for scholarly activities. You expand either the publications and research projects section or the personal presentations and roles section. Either of those two sections will have access to what's listed there as a department report. In the department report, you can generate a report using the ACGME format. So you can select a specific date range or all dates, select the ACGME format option. Say, for example, I want to run a report on all my faculty. And notice in this case, it's listed as all users versus local users. Click Add Local. That's going to pick all your local faculty for you. Go to the bottom, leave all the default settings here, click OK. And I'll get an ACGME formatted report that I can then key into ADS. Again, unfortunately, the ACGME does not offer a data importing process, so this data does have to get manually keyed in. So this is the idea of, again, streamlined data management. By tracking conference attendance, you're automatically able to generate an ACGME scholarly activities report, and all that data also feeds into the scholarly activities section of the APE module. All your clinical hour data that are reported by the residents are automatically integrated as well. Remember that there are essentially 3 key methods of clinical hour tracking. One is the manual data tracking, where your residents are able to manually submit what their clinical hours are. And I'll show you this process just as a quick reminder. This is what the manual data process is, where a resident, and I'm going to pull up John Adams as an example here, the resident is able to look at their schedule. The system is now pulling their data out of their previous records, and the resident is able to say, yes, for Thursday, I am actually working till this particular time. They click save, and that will save their information in the system. And that this is the manual data processing method. The other method is to use the MyQuickPass process. With MyQuickPass, you set geofences, and residents are automatically tracked. Their clinical hours are automatically tracked based on them coming in and leaving different clinical locations. And the third is by scanning QR codes, either for conferences or scanning QR codes for clinical activities. And as a quick reminder for QR code scanning under the clinical hours module, as an administrator, if you go under settings, you can go to manage activity types. And for each one of the activity categories, you have different activity types, and those activity types that are active, such as, let's say, patient care outpatient, I can generate a QR code for that. I can take this QR code for patient care outpatient and post this at the entryway and the exitway of our clinic, and instruct the residents to use the MyEvals app to scan a QR code when they come into the clinic and to scan a QR code when they're leaving the clinic. So instead of them having to go to the manual process, they can just simply scan the QR code, and the entry and exit will mark the total time. But it's very important that they have to scan the QR code at the start and at the end of each activity in order to receive credit for it. Otherwise, they will not receive credit for it. Then the next is going to be procedures and patient logs. So the residents are able to submit their procedures and or patient logs directly into MyEvaluations. However, if your program, your trainees are already reporting that data to ADS, I don't recommend, nor do I want them to submit the same procedures and case logs into MyEvaluations. That creates redundancy, and that just creates resident dissatisfaction to have to submit the data in 2 places. So instead, it's important that you import the data from ADS into MyEvaluations just to keep the data present, so you can see how a resident is performing as part of the APE process and as part of their graduation process. Then research projects. These are all going to be things that are being submitted by the trainees, by trainees and by faculty. That's going to be done in a couple of different ways. So as a resident or as a faculty, I'm able to go into the scholarly activities section under publications and research projects, and I'm actually able to upload my own research projects that I'm working on by clicking on Add New Publication and Research Project. I got a pop-up here. I'm just going to expand this out so you could see it in more detail. We'll zoom in a little bit. So what am I actually working on? I'm working on a professional journal submission. It's in an abstract format. These are the domains that the ACGME is monitoring. So we'll call this a research. and it gives an explanation based on the ACGME definition. It's a research in basic science education or translational science, patient care, or population health. I can attach a file, give it a title, a description, put in a date of publication. If there's a PubMed ID associated with this, because it's a professional journal, I'm required to put that in. I can put in an external hyperlink to that particular article. I can then have specific PGY level credit for it. And then I can also select the specific faculty that was my supervising faculty. So in other words, a resident is able to kill two birds with one stone. They are submitting their own information, but simultaneously they're giving their supervising faculty scholarly activity credit as well. So this will end up populating both the profile for the resident and the profile for Julie Andrews, the supervising faculty. And we'll talk about the user access level in a little bit. So those research projects are easy for them to submit, and we'll cross that into quality improvement projects a little bit later on. The next area is curriculum review. You're able to set up all your curriculum in My Valuations. That curriculum can be uploaded through My Portfolio or through managing your rotation requirements. And then the system is going to track whether the curriculum has been reviewed or not. So the system will automatically send notifications, and you can see objectively at the program level how many of your curriculum items have been reviewed and have not been reviewed. And of course, the last item is our quality improvement recommendations, again, through the My Portfolio module, and also through the main interface where residents are logging into the system. They're able to submit their scholarly activities directly through there as well. So here, when you look at the main login screen, looking at a resident, there's a section here for scholarly activities that allows them to submit publications and research projects, submit personal presentations and roles, and submit quality improvement projects directly from there. That's available to all your residents and all your faculty. As of the recording of this particular webinar, all of you should note that you have a switch where you can switch between the old interface and the new interface. I recommend for all of you to start becoming familiar with the new My Valuations interface. This is the older interface. So I recommend you switch to the new interface so that you can become familiar with it. Our intention is before the start of the next academic year to fully migrate to the new interface. So we have had already extensive webinars on the new interface. We've had extensive webinars on the performance dashboard and your ability to be able to look at the performance of individual residents. The onboarding and credentialing module, as well as the system implementation dashboard, are all implemented in this new component. In addition to the performance summary section, we also have a multitude of other sections that we've also brought up and reviewed with you as well, and we encourage you to take a look at all of those and become more familiar with them in order to implement them. Selecting those options will automatically redirect the resident or the faculty to My Portfolio under the scholarly activities section, and they have access to publications, personal presentations, and QI projects. So let's review these sections individually to become a bit more familiar with them in terms of what each one of these components do. The first section is for scholarly activities. Everything I'm showing you here, although it's categorized as a user submission section, it's available to both users and to administrators. That means any user and any administrator can do this. The difference between you and as an administrator and your faculty and residents is you have the ability to select other users. So when you log in, you have a drop down here that you can look up an individual and actually bring that individual's portfolio up and to see what's in their portfolio. It's different when the user actually logs into the system. They are not able to select other people to see their profiles. In that case, they're going to be limited to only being able to see their own individual data points. So moving forward, we're going to look at the first section here, which is scholarly activities for publications and research projects. I was mentioning to you earlier that under each one of these categories, when you go in to add a new research project or add a new personal presentation, I'm just going to zoom in on this again. I want everybody to be able to see it clearly. You'll see that every submission has a user access level associated with it, and you'll notice that it's defaulted to private. There are 3 other options, and I want you to clearly understand what those other options represent. The option of department, and notice when I select department, it says confirm access level change. Document will be visible to all users in the department. So I'm putting my publication into the system. Do I want other people in the department to be able to see my publication? Is there a problem with that? No, there's no problem with that. So I can change that and say department. Now, if I leave this under the option for private, the document is only going to be visible in my profile. Now, it is important that you realize that as an administrator, you will have access to all private documents in everyone's profile. Why? Because you're able to select any user, and when you select that user, you can see all their information. So the idea of private, it's not private to you as the administrator, but it's private to the other users in the department, because you'll notice that under this section, it's defaulted to personal files. If I select the option for all files, the system will refresh and show the publications and research projects for everyone in the program, not just for me individually. So that's the main difference here. So if I select department, I'm saying everyone who's in my department can see this document. If I select institution, I'm saying that every user in my institution can see this document. And if a document is listed as director, I'm saying that this document will only be visible to those with program director access level. So this is a way of adding a document that's only available to the program director. In that case, it will not be visible to an administrator in the department. So that summarizes the various access levels. And these access levels are going to be throughout the document uploading process in my portfolio. You'll see them scattered all over the place. And I reviewed with you that the various options here for submitting that. Then under personal presentations and roles, here you have a different data set for uploading into the system. So instead of focusing on publications and research projects, here we're going to focus on personal presentations and any roles. Again, these are defined by the ACGME. Are these abstracts, conference presentations, formal teaching roles? Again, all of these are directly related back to your ADS reporting. And the category of other presentations, this category is essentially directly related to all the various conference presentations that you have. There is an extensive webinar on your document domains and your document subjects, and there's a help document on that for you to better understand that link and connectivity. I'm going to review those things with you briefly today, but if you want to get a much deeper understanding of what these various document subjects mean, you're welcome to review that at your own convenience. So here, in terms of uploading our documents, we'd say, for example, this could have been a ground rounds. What's the specific domain? These are the domains defined by the ACGME. So you can add your own domains, but it's important for you to understand that adding a domain may not line up with the ACGME reporting process. So if it is not domain specific, then just leave it as the option of no domain specified. And again, we go through the title, the description, the date, for what level am I getting this credit for, and we're going to review the required optional in a little bit. So this becomes the scholarly activities reporting process here. And then the last area is the quality improvement project area. And under the quality improvement project area, your trainees and your faculty are able to add new quality improvement project recommendations into the system. So you have a central method allowing your trainees to actually submit individual quality improvement project recommendations. Again, under the menu, scholarly activities, where we can go to quality improvement projects. Here, I will see a list of all the existing quality improvement projects that I've submitted versus all departments. I can click on add new quality improvement projects. I'll get a screen with a drop down to select a project. The first option there is to add a new project, and I have the ability to look at all the existing projects in there as well. And what's the project access level? Is it at a department level or at the institution level? So I am going through, essentially, I am creating as a trainee or as a faculty, I'm creating the framework of the QI project recommendation. What's the description, the source of concern, the date project should be initiated, the potential impact of the project. I can set an action plan within the project itself. That's the same action plans we discussed earlier. I can attach a document. Now, I'm logged in as Cindy Crawford right now, so the project leader is automatically selected in here as Cindy Crawford. I can add additional users as project leaders, and then I can also add specific project participants. Again, it's selecting me by default, and I can select others. Now, I'm logged in as Cindy Crawford, who's a program director, so I have the ability to also assign this project to a specific admin, set a due date, and have a particular status on this. This could be something that is under review, or it is implemented partially. The resident will not have these options. They will be able to create that framework, and when they create that framework, all their submissions will be under review. So they are not directly put into the system as, hey, this is a quality improvement project that's ready to go. And as we go through the rest of the APE module, you'll see under the program tab, your program evaluation committee is able to go under quality improvement projects in order to see all of those quality improvement projects that are submitted, and they're able to edit them, review them, and decide, hey, this is actually a great idea. Let's go ahead and start this particular project. And they can search for keywords within these projects as well. So it's a really nice way for you to be able to connect the dots between what's happening on the scholarly activities level for quality improvement projects, and an opportunity for the program director and the program evaluation committee to review those projects and take action plans on them. So all of this, again, is available under the scholarly activities section. Now, I've now focused on the data that's coming from users. The first area that we talked about is the ACGME data importing. The second of three areas was user submission of data. Now the third and final area for data submission comes from administrative submission of data. That means what's the work that an administrator has to do to make sure we get automatic data integration? Well, the first is you have to make sure you're assigning evaluations. Those evaluations are either being assigned automatically based on the schedule, or they're being assigned voluntarily, where someone does an evaluation ad hoc, or they're being assigned manually by you as an administrator. The other thing you need to do is you want to upload all your compliance correspondence that you get from ADS. And we're going to review that in just a few minutes. And this is where you're going under the My Portfolio under compliance documentation. I'm going to go back to Cindy Crawford's profile. I could stay under the residence profile. They don't see compliance documentation, but under Cindy Crawford, the program director, this is where we're going to review uploading compliance correspondence from the ACGME. And this is also where we're going to review uploading your accreditation document from the ACGME in terms of uploading specifically items such as your citations and your areas for improvement. So directly under My Portfolio, when you're looking under accreditation document, you can add your accreditation document that you get from the ACGME. Got a little bit of a delay in that coming up. What is the letter I received? Oh, well, we received an accreditation letter from the ACGME. That letter came in on June 3rd. The date of the action was from April 9th. Here was the program director. The review action was continued accreditation. And the reason, there were some essential GME violations. However, we did get accredited, and we're accredited for 2 years. We didn't get the full 5 years, so it automatically sets dates in there for us. And this is where I can start to add my citations and AFIs. So directly from the letter from the ACGME, you can actually, on that letter, it's going to give you a citation category, and then that you can select the particular program requirement that you have not met. So on the letter itself, it will have a specific area. You're able to select that area, copy and paste from the PDF the citation details. And again, here you have the idea of who am I assigning it to? When is this due to be corrected by? What's the action plan? And what's our current internal status for it? And what is the ACGME's status for this item? So all of these citations are then in turn, or areas for improvement, are in turn reported on the APE module centrally. Then we have our in-training exam scores. So you are able to upload individual resident in-training exam scores, but here we're talking about actually putting in program in-training exam scores. So we'll review this when we go through individual sections, but under the section for residents for in-training exam performance, this is where you would identify what was your program's internal performance on the in-training exam and what was the national average. So if the national average, for example, was 63 and your program's average was 78, that's great. But if the national average was 92 and your program average was 78, it will highlight this section in red and it will prompt you to take action because the system sees an area of potential weakness. So again, this is just a space for you to put in those exam scores generally. I'm going to go into this more detail as we go through each one of these sections as well. And then we have ACGME resident and faculty surveys, which can be uploaded into the system as well. So as I've reviewed with you a few moments ago, under My Portfolio, you want to go to Compliance Documentation, and this is where you can upload your accreditation documentation and any general correspondence that you've received from the ACGME. The most important component is the accreditation documentation section, where you're able to upload those citations and areas for improvement. That's the key area that I want to focus on, that I want you to focus on. Just take that PDF you received from the ACGME, upload the document, fill in the fields as I instructed you a minute ago. I'm just going through those screens. Then in terms of the in-training exam, you're going to go under the APE module, under the resident section, under in-training exam. Now, under that in-training exam score section, you can have the option for percentage scores or numeric scores. You're going to have to select which one of the two you're actually utilizing. It varies from specialty to specialty. Some of you are based on scores and some of you are based on percentages. So you want to take that that particular detail in there and change that that submission. In addition, under the in-training exam score, you also have the ability to do summary submissions as well. In the summary submission section, you're able to look at more details of the actual examination in terms of how did the residents do on individual topic areas in the detailed versus what's in the summary. So in the summary, we just have a single program average and we have a single national average. But if we click on the option for summary, the system is going to present us with the ability to look at more details for our subject. So here I click on the summary, it changes it to details, and then for your particular specialty, it's going to list all the various categories that were on the in-training exam. What's the purpose of this? Well, here, the idea is for us to, and I have this zoomed in for you to be able to see the details. The idea here is for us to identify specific areas of weakness. So for example, if in the area for GI, all programs performance were 90% and our program's performance was 50%, and we ranked in the 99th, for example, it gives us the option to now take an action plan on that specific topic area. That's the example where I said we can say we want to put in an action plan for more GI lectures, for example. Remember, all these action plans are in turn being tracked here under the monitoring section. So each action plan doesn't just get lost, but it's going to be tracked for you and you can monitor it over a 5-year period. So rather than this being some vague, obscure data point of, hey, we didn't do well on the in-training exam, it actually becomes an action item for your program to work on. The other area for you as an admin is for you to upload the ACGME survey results. There are two components to that ACGME survey. One component is the PDF document. That's an actual report that has graphs in it showing your performance compared to the national average. The second is the actual data file, which is an Excel file that you can export out of ADS. So when you look at your program tab under ACGME resident and faculty surveys, the graph that's laid out there, the graph is based on the data that you've uploaded into the system. So when I click on the program tab and I select resident and faculty surveys, I think a little gap there. While that's coming up, I'll just use the screen here. And you select resident and faculty surveys, you're actually going to see a graphical representation of your data over a 5-year period. So rather than just looking at a single report, you can see how you're doing year over year. And there are 2 buttons here. One is for adding the ACGME resident survey. That's your PDF file. And import ACGME survey results is for actually importing the individual data points and results into the system. That will populate both the table, and it will populate the graph for you. So you'll get both sets. You're going to do one data importing for the residents and another set of data importing you're going to do for the faculty. So each one is done individually and independent of the other. They're not directly tied to each other. Then the other area is after importing the resident, you do the faculty, as I mentioned. The other area is for doing your self-studies. So directly within My Evaluations, we have provided you with the self-studies. We've already provided you with a series of self-studies that are available from the menu option, Edit Evaluations. There are self-studies designed for coordinators, faculty, fellows, nurses, and residents. And all of these are designed for you to assign to those various groups. And then under the program section for self-study results, you're able to select those surveys, and the system will automatically display the summative results of those self-studies. So the purpose of the self-study is to use it both within the annual program evaluation process for the PEC to review specific areas of concern from either the residents or faculty or nurses, or it can be used on looking at individual program performance. So again, all of this is already available for you in the system. You can take those existing evaluations and edit them as you see fit, and utilize them for your own benefit as you need them. There's no particular requirements as to what should be included on self-studies. So the questions that we've put together on those self-studies are really based on best practices of what we would want offered by the residents. So here's an example of the types of questions. You can see that the questions are source-based. So we're providing you the source of the self-study. This comes from an ACGME self-study journal. The program provided adequate education experience for me to know how to understand and explain procedures required. Or the program provided adequate training in performing procedures required in my specialty. And sim centers, hands-on observation. So you can customize these the way you find is most appropriate for your individual program, but you have those sample evaluations to utilize through our system as well. So really, in terms of administrative submission of information, that's it. What I reviewed a few slides ago in terms of the overarching responsibilities that you have are there. And then beyond that, everything happens, everything else will happen automatically. So the automatic data integration is going to include all your milestone, EPA, and competencies will automatically show up in the APE module. All the scholarly activities will automatically show, procedures and patient logs, the performance of evaluations, review of goals and objectives will be listed, and we're going to go through these individually. All your ACGME citations and AFIs that you've uploaded administratively will automatically show up. Clinical hour compliance and quality improvement projects. There's one other area on visa requirements that we also include in there. That's more of an optional section. It certainly is not an ACGME requirement, but we do include that as part of the automatic data that's pulled in, where all the demographics of the users from their visas they have is automatically included in the APE module as well. So let's go through these various modules in terms of how that automatic data integration actually works and what you can expect to see in the system. So the first area is going to be in regards to milestone performance. You can see there are 3 sets of graphs here that show individual performance that's directly available. So in terms of EPA performance, notice there's PGY specific performance, milestone performance, and competency performance. So for programs such as surgery, where you have established EPAs now that you're tracking, those are all going to be listed here. For programs like family medicine, your sets of EPAs are also included, and we're also providing milestone performance tracking on that. So in the middle, where I've now selected ACGME internal medicine as the default, for family medicine programs, you'll have additional options to choose your family medicine related categories in there as well. And for family medicine, we're tracking the 24-25 requirements separate than 25-26, and then in 26-27, where the final phase is, that's being tracked separately as well. So here, looking at the APE module, we go under the resident tab here. We have evaluation and milestone performance, and you can see the graphical representation comes up. We can look at each individual PGY level to see how they're doing in terms of their milestones. Their core competencies are listed in here as well, and the EPA performance is listed in here as well. Then the next section for automatic data integration is scholarly activities. All of that is also broken down for scholarly activities for residents versus scholarly activities for faculty. The next section right after evaluation performance is scholarly activities. So the scholarly activities section is divided into publications and personal presentations. These fields in here are meant for you to administratively override something. So for example, if you know that last year your PGY1s, or the current year your PGY1s have actually done 2 research projects and your PGY4 did 1 research project, you could manually upload that information by just putting the number in here, and it will override the 0 value. Of course, we want the residents and the faculty to submit that information through My Portfolio, but these fields just represent an override field. So when you click Save at the bottom, it'll actually save and update that information directly in the system. Then you have the summary submission section. If you click on summary, it'll switch to detailed submission. And this format is just like the ADS. So it allows you to manually populate that information on here as well, if that's more comfortable for you. So you can switch between those 2 options. The next section is for procedures and patient logs. Procedure patient logs, as I've mentioned before, get automatically pulled in from the data they submit through the system or the data that you import from ADS. So this also has fields that allow you to administratively override the numbers that are in the system if you need to make modifications. And you can see in terms of patient log completion, we have very large numbers here because this represents data that was imported into the system from ADS. Some surgical programs will do all their case log importing. The residents will only submit procedures such as central lines, thoracentesis, things that are not tracked in ADS. They'll report through My Evaluations. Then from the resident and faculty tabs, we can start moving into the program tab. So the program tab itself has everything that has to do with your program in general listed in it. So the resident section is focused on a small fraction of items. It's focused on their in-training exams, their evaluation and milestone performance, scholarly activities, procedures, and patient logs. Again, right now, I'm focusing on automatic data. I'm not focusing on what each individual tab does, but I want you to understand where automatic data comes in. So under the program tab, you also have automatic data coming in. So I reviewed with you already that the program evaluation performance is automatically populated. The goals and objectives are automatically populated. So here, when you go to the program evaluation performance section, the system is automatically populating the graphical layout like I reviewed with you before. And then going down the page, we can see individual sections of the raw data for the three sections I mentioned, the resident performance, faculty section, and the program section. After the evaluation performance, then the goals and objectives are also automatically tracked in the system. So what's exactly being tracked in the system? Well, if I pull up the goals and objectives for this specific academic year, what I see is some of these goals and objectives have a yellow spot next to them. Well, this yellow spot here actually represents the total reviews for that program that are less than 80%. So why is it that some of them here, which is 0, they are not highlighted in yellow? So if I bring up the actual page, I can see only some of them are highlighted in yellow, and some of them say 300% or 200%, for example. Why do we have this situation? Well, if you have a situation where no notifications were sent, so in this anesthesiology rotation, there were no notifications that were sent, but one person still reviewed the goals and objectives in the PGY3 level. So there is no review percentage there in that case. So over here it says 17%. So it's telling you that there was one notice sent to a PGY1, one notice sent to a PGY3. In total, there were 6 notices sent out, but only in total 1 notice was reviewed. So that's 17% of the notifications were reviewed. So it's not necessarily an indication of people who go in and manually choose to review something. It's an indication of how many people actually clicked on the email links to review the goals and objectives that were sent out. So what's the purpose of including goals and objectives here? Well, you look at a program's performance, such as your board pass rate or your in-training exam performance. If you're seeing a particular weakness in gastroenterology and nobody's reading the goals and objectives for gastroenterology, well, there's a problem there that needs to be addressed. So it's the idea of, hey, are we sending out notifications, number one, and number two, what percentage of the residents are actually reviewing them? What do we need to do to change that accountability if people aren't reviewing the goals and objectives? So as I mentioned before, all your ACGME citations that you have administratively uploaded through the My Portfolio accreditation section for compliance documentation, all of that information is automatically shown in here as well. So that next tab after goals and objectives is ACGME citations. So that's going to list individual citations. We can see 2 of them have been fully corrected. 1 of them is pending a plan. So the program evaluation committee sees that. It doesn't become some vague other document that's someplace else, but it's something that is directly available for them to review. Again, that data came in automatically, but you put it into the system administratively. Then the next section is clinical hour compliance. You don't have to do anything for that. The residents are submitting their clinical hours, and based on clinical hour submissions, The program evaluation committee can see the total average hours worked per rotation. They can see which rotations have violations in 80 hours, 1 in 7, the 24 plus 4 hours, the rest requirements, the call frequency, and the night float frequency. So this allows them to get an overview of saying, hey, we have some rotations here, such as the cardiology ICU, that has violations in it. What's going on in that rotation? What are we doing to address that particular issue and to set up an action plan to address it? Then the next section that comes after that is going to be your quality improvement projects. Now, when you look at the program section, from clinical hours, I have skipped transition of care, supervision of resident, program evaluation, compliance, and I've gone to quality improvement project because these items are not about automatic data population. I'm right now focusing only on automatic data population. So all your quality improvement projects are automatically get pulled into the system as well for the PEC to review. And then the last section is under the stability tab of my portfolio, and this is for visa requirements. This is optional. It's not an ACGB requirement, but if you go under stability and you scroll down here to visa requirements, based on the demographics of the residents that you've put into their profile, the system will auto-populate how many J1 visas you have and other details. And of course, there's a field for you to administratively override things as well. So this is all your automatic data importing and population. So for you to get going with the APE module, your next step is to manage your PEC. What you want to do is you need to set up your program evaluation committee members, and you need to set up your committee review dates. So once you've done the first step, which I discussed with you, which is to set up your managed core personnel of your core faculty and your core residents, you're going to log into My Evaluations and you're going to go through and populate the committee information. Again, towards the end of this webinar, I'm going to review with you the changes that are happening to this module. For right now, you're populating 4 dates in here, the date of review meeting. So when is that this current meeting occurring? What is the effective date of this policy? Typically, it's going to be the beginning of the academic year. When is our annual review date? And when will be the next review date? And then here, you're going to populate your PEC. The requirement is to have 2 faculty and 1 resident or fellow. When you select those individuals, this section is going to turn green. This is where you're directly getting the involvement of your core faculty and your residents in the PEC process. Every person that you add to this list will get an email notification automatically sent to them that they've been added as a program evaluation committee member, and they will have access to review and manage the annual program evaluation module. So they don't have administrative access into the system, but they have access into the PEC as a PEC into the APE module, allowing them to give direct input into this process that we're discussing today. So that's your next step, is to go through and set those up. Now, under the committee tab, we have additional items that have been pre-populated for you. In step 3, so what I'm discussing with you right now is under that same committee tab. Step 1, you put your review dates. Step 2, you select your program evaluation committee members. Step 3, you're going to review your policies and procedures. Those policies and procedures are divided into the following sections, and we have already pre-populated sample text for you that you can customize. The first section is what's the purpose of this program evaluation committee. Now, in the purpose section, you'll see that there is a name and an institution that has been intentionally left in brackets because we want you to manually put that text in there. So make sure you get rid of the brackets and the name or brackets and the institution, and you manually populate that. We're doing that as a way to make sure that you're actively involved in the process. So for the purpose section, you'll populate that. And then in the policy section, we have already a pre-configured policy, which you can customize. As you scroll down that section, there's a separate section for responsibilities of the PEC. Again, we've populated a basic template for you that you can customize. And then you have the next section for the actual procedure of the committee. So to get the process going, you're going to go down to step 3 and just replace the text here for name and replace the text here for institution. You'll go through. I recommend that the program director and the PEC members review the text in here to make sure that it aligns up with your actual purpose, policy, and responsibilities of the PEC. Now, because a lot of the other sections are already pre-populated for you, there isn't a lot for you to have to do. Instead, I now want to focus on the sections that the Program Evaluation Committee has to do. So do they go through all the sections and review it? Yes, they do. Specifically, after completing the committee section, the next section for best practices to review are the sections under transition of care and the sections for supervision of residents. Now, we've populated specific text for you already for the transitions of care. In transition of care, there are multiple sections. There's one that deals specifically with the handoff policy. So here it's asking you to describe the program's handoff policy in order to ensure the quality and safety of patient care. We have provided you with default text there. Of course, you can customize it, but we've given you some text that the PEC should review. The next section has to do with schedule design. Again, all of this is in transition of care. Describe how the resident schedule is designed in order to minimize the number of transitions. Again, this has to do with patient safety. Notice that these categories align up directly with transition of care requirements that the ACGME refers to in the common program requirements, and where they ask you, what is your transition of care policy? And of course, all of these, you can generate reports on it, but it gives you a way for the PEC to directly see those policies and comment on them. And the third section under transition of care has to do with monitoring. Describe how the institution ensures and monitors effective structured handoff policy. So this is, again, something that we should review. So all of this is described in the tab for program under transition of care. Each one of these is listed individually, and notice that each individual item has a take action plan. So if the Program Evaluation Committee sees that there is a particular weakness or issue with any of these sections, they can initiate a take action plan. I want to remind you that on each take action plan, not only are you assigning it to a specific administrator and setting a particular due date, and the current status, let's say, might be implemented partially, you're able to set up departmental and institutional email notifications. So at the department level, you might want to say that, hey, I want these individuals who are on my program evaluation committee or outside of it to receive daily, weekly, twice weekly, bi-weekly, monthly, or bi-monthly notifications. And these notifications will start 3 months before the due date. So by setting things like this up, if the due date is August 16th and today is June 6th, the system will immediately start sending out notifications on a whatever cycle that you set up on these. So this applies to both the SWOT and the PDSA model where you have these reminder notifications that can go out. So the next section after the transition of care that the Program Evaluation Committee should be reviewing has to do with specifics on alert management and fatigue mitigation. So the policy for alertness management and fatigue mitigation has to do with a specific policy, which we pre-populated, and a mitigation process. So how do you actually mitigate these particular issues? This is also an important part of your whole alertness survey that the ACGME does. So all of this is actually tracked in the section that deals with ACGME well-being survey, which has a subsection called alertness management and fatigue mitigation. So right at the top of the program section, you have that. So you're able to not only upload the data for your fatigue surveys that are done by the ACGME, and all that data is also tracked for you. So those are the specific survey questions are being tracked for you over a 5-year trend. But the actual data is also uploaded into the table. The actual survey is available for your Program Evaluation Committee to review if they want to see the actual data. In addition, on other webinars, we've talked about the Oldenburg Burnout Inventory Assessment that we have in my evaluations. So if you have implemented that survey, you can simply select that survey and the system will provide a summary result for your program. So in this case, it's telling me that I'm at medium risk for burnout and disengagement with my residents, and I'm at high risk for burnout and exhaustion. That's based on the survey results, and this is based on the following criteria. And here's a reference for how we came up with those criteria. So again, this gives the Program Evaluation Committee and the program director to see how are we doing on the ACGME survey, how are the residents rating themselves in terms of burnout, and then what is our particular policy and mitigation process, and what take action plans do we need to take. And we even have a space here where we can upload our individual alert management and fatigue mitigation document that we distribute to all the residents. And this particular document is set up to send out automatic notifications. So it's telling me what percentage of my attendings, residents, fellows, students, nurses, and PA technicians and other have actually reviewed this document. So in one section, I'm getting a lot of information, including that important idea of being able to take action plans. And the next, or I should say the third section, after reviewing fatigue mitigation, has to do with supervision of residents. So this is right under the transition of care section, which I'll bring up on the screen in a minute. So under supervision policy, we have set that up for you. You can customize it. And the next section has to do with trainee policy. And the third section is the critical event policy. So what happens in the event of something bad happening? What is our policy for managing that? So we have already defined the supervision of residents for you, which you can customize, the trainee policy, and then here the critical event policy. You'll notice here that the Common Program Requirements section 6D is also listed, which has to do with implementing and tracking levels of supervision. We have separate webinars that talk about this. You want to make sure that you enable tracking of supervision requirements in your program if you don't already have it, and you want to enable of tracking requirements in the curricular assessment worksheet. And there's a specific question here. Has the program communicated to residents, faculty, staff how to identify supervisory roles? This is an important question that a site visitor will ask your residents, your nurses, and your faculty. So you want to make sure you address that question. And another one is, does the program educate all residents on guidelines for circumstances and events in which residents must communicate with appropriate supervising faculty members, such as transfer of patients in an intensive care unit or end-of-life decisions? These are all part of that whole supervision of residents. So this becomes part of the PEC's responsibilities. And there are some optional sections here for you to comment on participating sites, clerkships, and match details in terms of number of positions that were matched and what types of trainees are we getting. And that visa requirement that I mentioned for you is all optional. And there's another optional section on FTE requirements as well. Now, the last component is the monitoring component. That is the key element of your whole APE process. In the monitoring section, there are 3 components. There's a general monitoring section that shows you your total action plans, how many are incomplete and complete, including your strengths, weaknesses, opportunities, and threats over a 5-year plan. All of these are clickable, so you can click on them to bring up specific items. And by clicking on monitoring, we can click on specific items, which opens up a pop-up and shows us particular items that we have. The next section has to do with incomplete action plans, which shows us a segregation between action plans. Those are our take action plans versus our citations and AFIs. Those two are tracked separately. What is very key to note in these items, so when we're looking at incomplete action plans, is the Program Evaluation Committee's ability to prioritize items. So for example, this item over here from 2019, not tracking levels of supervision, if that's a higher priority item, I can grab it with my mouse and move it up to a higher priority level. So from number 8, it becomes number 2. So all of these types of changes, remember that idea of clicking save and finish later, either at the top or bottom of the page, but that's an important component of the monitoring process, is the idea of prioritizing things by the PEC and being able to see all those items over the course of multiple years. And the third section in monitoring has to do with items that have already been implemented. Again, those are divided as action plans and citations separately. So when I'm looking here, I see my overall, then I see my incomplete action plans, and below that, I see my implemented action plans. And then afterwards, I have some comment fields here that allow me to write actual summaries that have to do with 4 summary note sections, one on program strengths, program weaknesses, concerns within the program, and specific reviews of the program notes. So the overall admin experience of this is all driven through the interface of the APE module. In addition, from the menu option evaluations, you have access to APE reports. So here, if I go to the menu option evaluations, this is where I access my APE module, manage my core personnel, my data importing, and I have 3 reports that I can run on the annual program evaluation process, as well as common program requirements and institutional reports. So under the annual program evaluation process, all those tabs we just reviewed or sections are listed here. So for example, if I pick program, here it's going to list all the various sections. So if I want to run a report on our self-study, I can just pick that and then run a report on the self-study. And then for my action plans, it will either list my action plans for just the selected year, or I can say, no, actually show me all my action plans. So it's a very easy way for you to be able to generate reports on all the data that you've collected. It will show you a breakdown of everything that you choose, including all the breakdowns on your in-training exams and everything else. Now I know because of the technical difficulties that we had, we lost a considerable amount of time. So I do want to take a few minutes to show you the functionalities that are coming soon. Unfortunately, quite a few of you have already left the session, but I still want to take you through. So what's coming later on this academic year in terms of the new module? Well, the new APE module is going to look quite different than the current APE module that you have. It has, you still have your status bar, but you have a very robust new interface that we have developed that gives you, instead of a horizontal view of tabs, you have a vertical view on tabs where you can see performance of the various sections listed here. We have also included extensive monitoring reporting, including graphical layouts of all your strengths, weaknesses, opportunities, and threats laid out graphically for you. One of the really important new sections that we're adding is a committee management section that is much more robust than the one that you have right now by including a meeting manager directly within the module. So with the meeting manager, it actually allows you to set up meeting dates for each one of your individual PEC meetings. Your PEC members are going to receive notifications, and in that module, you're able, in the meeting manager, you'll be able to also do attendance tracking. So it allows you to set that meeting date and time, how many people you've invited, how many people actually attended by checking off the people who actually showed up. And it also gives you the opportunity to give a meeting title, set an agenda, and also to take notes at what happened at the individual meeting. So that's one of the biggest changes that we're making to the PEC module, that ability for you to track your individual PEC meetings rather than having everything just being commented the way they are right now within the system. So I really appreciate your patience. I apologize for my technical difficulties today. I know we lost a few minutes of time with the system reload that I have to do. I appreciate those of you who've stayed on. I'd like to open up to any questions, and I'd like to also open up to any comments that you might have in terms of how we might be able to enhance your individual experiences in the system. I don't see any specific questions that are in there right now. I have unmuted you, so for those of you who are still with us, I'd welcome any comments that you can give on your APE process. From what I shared with you, how do you feel about that process? How can we make that process easier for you or better for you? Any comments, any questions?